While in Jerusalem on a 2-week tour, one of your group members goes missing. After 2 days of searching, the person is found dressed in a white bedsheet, standing in front of a famous church, giving a sermon on the coming of the Messiah. This is a classic case of Jerusalem syndrome, a psychiatric disorder that affects seemingly balanced people who, upon arriving in Jerusalem, start to exhibit bizarre, religiously motivated behavior. This presentation would define the 3 recognized forms of Jerusalem syndrome, paying specific attention to the form described in the example that I just gave. Finally, treatments for each of the types will be given. The 3 categories of Jerusalem syndrome are described by Dr. Yair Bar-El in an article in the British Journal of Psychiatry titled Jerusalem Syndrome. The first 2 categories of Jerusalem syndrome affect people who already have varying degrees of pre-existing psychiatric disorder. The first type of Jerusalem syndrome affects people who have been diagnosed with a psychosis before going to Jerusalem. This psychosis causes them to believe that they have some kind of a specific mission that can only be carried out in Jerusalem. While carrying out their mission, they often pose a danger to themselves and others, and after being treated for varying lengths of time in a hospital setting, often including the use of medication, they are sent back home to the country from which they came from. The second type of Jerusalem syndrome is composed of people who have been diagnosed with a non-psychotic psychiatric condition, such as a personality disorder or obsessive compulsive disorder. Their disorder causes them to fixate on a specific idea, and this fixation causes them to travel to Jerusalem to act upon their compulsion. Since people in this group do not cause harm to themselves or others, they are often left untreated. While the first 2 categories of Jerusalem syndrome are defined by a varying degree of severity of pre-existing psychiatric conditions, the third category consists of people who have no previous history of psychiatric order or drug use. For this reason, type 3 of Jerusalem syndrome is the most intriguing to me. After arriving in Jerusalem as part of a tour group or as an individual, the people who form this group suffer an intense psychotic reaction that only lasts for a short period of time. Dr. Yair Bar-El defines this psychotic event as having the following distinct phases. First, the patient will show signs of agitation, anxiety, and tension, followed by publicly expressing the desire to split away from the group. After separating from the group, the patient will become obsessed with purity and cleanliness. This culminates in the making of a long white toga-like robe. Then the patient will begin to shout out biblical verses, psalms, or hymns in public. The final phase occurs when the patient walks in a procession-like manner to a specific holy site and proceeds to deliver a sermon. Type 3 Jerusalem syndrome is similar to type 2 insofar as patients pose no threat to themselves or others. After a short period of observation that doesn't necessarily take place in a hospital setting, the patient leaves Jerusalem. After leaving Jerusalem, all symptoms disappear as suddenly as they came. This is what makes type 3 so interesting to me.